Okay.
And we are recording. So do you want me to, I'll start off then.
Yeah.
So welcome to Nurse Table Talk. Kathy and I are here today to talk to you. Hi, Kathy.
Hello, Julie.
Hi. About dementia. We have a 3-part series. Today's topic is what is dementia? It's a basic overview. And then our video number 2 will be on the caregiver's 10 commandments. And then our final video, number 3, will be how to avoid caregiver stress syndrome. So, and by the end of these videos, you may have a better understanding, be more informed on how to be proactive and help your loved one with these conditions. So let's get started. So I'll start off by, providing an overview of what dementia is. So it's a general term for abnormal brain changes. And that can be, it's causing a cognitive decline. And there's a collective term for that because what it's doing is, dementia is the collective term, but what it's doing is causing cognitive and memory impairment. So Alzheimer's is the most common form of dementia. It affects about 60 to 80% of the cases. And the next most popular form of dementia is vascular dementia, and that is caused by microscopic bleeding or blocked vessel changes in the brain. So those are the 2 most common forms. But Kathy's going to pick up on this now.
Yeah, so when Julie and I were talking about this before we started taping, I said, in my experience, it often seems like it's not the patient who starts to notice that maybe they're not remembering or they're having trouble with word finding or they're having trouble remembering where they put their keys. It's more often the people that they live with. So if you are, the spouse of somebody who can't remember over and over and over again where they left this, that, or the other, can't recall things that happened, like, what they had for breakfast 2 hours ago. Those are kind of common themes of stories that I've heard over the years with helping people manage their dementia. But truly at its core, people have difficulty with tasks. They have difficulty with, fork to mouth, they have difficulty remembering the words of a song that they've always known. They have difficulty trying to find their words. So if you're having a conversation with somebody and for whatever reason, they can't remember a certain simple word, these can be things that are sort of like red flags. Now, Julie and I are joking around all the time about, blah, 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 what word am I looking for? What am I, So there are some memory changes that do happen as people age, but these are more severe. These are when you're worried about giving your loved one car keys and trusting that they remember how to put the car into drive and where the store actually is. These are people where you're nervous that they may get lost in a grocery store, or they are mellow Marvin all the time, and then a certain time of the day they grow horns and they're nasty, and then the next day they don't remember that they did it. That actually is called sundowners, and that's a real thing. But it's also where you are not in a two-sided relationship anymore. You start to feel like you're responsible for this person, not in a sense of loving somebody in a mutual relationship, but being nervous for that person, being scared, like they get up to go to the bathroom in the middle of the night and all of a sudden they're in the kitchen and the bathroom's way in the back of the house. So those are things, just kind of short and sweet examples of sort of what that can look like for people. And it's definitely different for everybody. But those are things that are pretty common.
Yeah. Right. That's really good information. And moving forward with some other things, there's not one specific test to diagnose for dementia. The physicians or the specialists, they'll do a careful assessment of somebody's medical history. Chronic conditions can contribute to that. age and risk factor as far as genetics can play a role. Chronic conditions such as heart disease or diabetes or high cholesterol, high blood pressure that's constant, and it's wear and tear on the body in that. So again, that's what's out there as far as contributing factors. That now, will every of those conditions contribute to every person? No, but those are things that may play a role. Again, everybody's genetics and medical history is different. Does that mean everybody's going to get it? No. But
No.
you, like Kathy said, you want to, your loved ones more than anybody, so it starts with you.
I think a lot of times too, the symptoms kind of help the doctor with the diagnosis. So when you go back to our video on advocacy, this is where this really comes in handy, and it's very applicable, because if your loved one doesn't even know that they're doing these things, then it's kind of up to you to be able to sit in the doctor's, to be the responsible caregiver, and sit in the doctor's office and say, I find him up, he goes to the bathroom, and, he's out the door, he thinks he's going somewhere, he got lost somewhere. So it's really a time to just really pipe up and not be shy and not be ashamed, and not worry about the repercussions, because there are, there's no cure for dementia.
Right.
But fortunately, in the world that we live in right now, there are a lot of other ways to manage it. Drugs, right, Julie?
Right. Some medications can maybe help temporarily improve symptoms, but there's no, like Kathy said, there's no cure. There's no, it's not going to stop the progression of dementia, but medications can possibly help.
Yeah.
Your providers are going to be the best answer. They're going to know you best and help you with that.
So in ending this part of the series, just know that just because someone you love is confused does not mean it's dementia. Could be a urinary tract infection, could be another kind of infection. But if you're starting to notice the things that we've mentioned, and you're starting to become concerned about your loved one's sense of safety, boundaries, mood, please, please, please let your primary care doctor make that person aware. Normally how it works these days is when you go to the primary care doctor and they interview your loved one, they're going to make a recommendation. And normally that's going to be either to a geriatrician, which is a doctor that specializes in older adults, a neurologist, which will look for brain changes, or a psychiatrist who will do a deeper dive to see if there's a different cause. And it really kind of depends on what your primary care doctor is comfortable in referring, or who they're comfortable referring to you to at that time. So we hope that this video kind of opens the door for conversation, and we know that this will help you save time, save money, and be much, much better informed about your healthcare. So join us for our video number 2, coming right up.
Like the content you just watched? Hit the like button or hit subscribe here. If you want to be notified of any future videos, please ring that bell. If there's any topic you'd like to see discussed, leave us a comment in the comment section. Nurse Table Talk. Save time, save money, be informed. Thanks for watching.